Hello, my name is Tara Flaherty. I live in Tampa, Florida, and I did my directed professional study at a private practice here called the Medical Nutrition Center. There are two dietitians that work at the Medical Nutrition Center, and as well as multiple interns that come through to learn. Both dietitians are actually functional nutrition dietitians, which basically means they have a specific interest in the integrated, personalized approach to nutrition and health. And they really focus on the whole person and not just on an isolated set of systems. Some of their specialties include digestive and eating disorders, diabetes and weight management, among many others. This is a picture of the outside of the facility. So when we come in the morning, we make sure that the practitioners are ready for any of the incoming patients. We create a review of systems, which I'll explain in the next slide. We communicate with the nurse who comes in to do lab draws, specifically for micronutrient testing. We perform body composition and bioelectrical impedance analysis procedures, which I'll also explain in a couple minutes. We communicate with any patients for the dietitians. Sometimes the patients call in and have questions, and we make sure that we get the right answers from the dietitians and communicate that back to the patients. And we kind of are the point of contact, and we make sure that the patients are comfortable and have a, proper appointment from start to finish. I know it's kind of hard to see, but this is called the review of systems. So when the patient first comes in, they fill out this form. They rank each of these symptoms from 0 to 4. 0 meaning they rarely or never have it, and 4 meaning they frequently have it and the effect is severe. And they total these up in each different section, and the practitioner looks these over and kind of uses it to assess what's going on with them. This is the bioelectrical impedance analysis. So the scale and that machine up top is for body composition. So we'll enter their age and their height. The patient will stand on the scale, and then a printout will come out showing, their weight, their body fat, their BMI, things like that. And then they'll lay down, and we hook up the electrodes to them for the bioelectrical impedance analysis. And it uses the muscle mass and the hydration levels to kind of paint a picture of the patient at a cellular level. During my practice hours at the Medical Nutrition Center, we had the opportunity to go to an IAEDP seminar, which is the International Association of Eating Disorder Professionals. We learned about acceptance and commitment therapy and eating disorders. It was interesting because there were a lot of psychologists there, as well as a lot of dietitians. The president of the foundation is actually a dietitian, so it kind of shows the integration between psychologists and dietitians as professionals. I decided to complete these objectives. And so, for example, my presentations, I did a presentation on inflammation, and more specifically, how the MTHFR mutation plays a role, as well as the elevated levels of homocysteine. This is actually one of my slides, a little blurry now I see. But basically, when there's an MTHFR mutation, it doesn't allow the body to use folate correctly, which leads to an elevated level of homocysteine, which can lead to inflammation. I also did a presentation for the dietitian at her request about insurance practices, and because due to the Affordable Care Act, things are changing, she wanted to make sure she was up to date on that. So I did a presentation for her. I got the opportunity to sit down with the dietitians in the office and really discuss some of their patients, talk about their background, look at their charts, and I got to kind of get a better picture of them as a whole. So based on this information, I wrote 10 PES statements. I was able to look over their lab values and see how any micronutrient deficiencies played a role in some of their symptoms. And I also did the same thing with the bioelectrical impedance analysis and body composition, just to kind of see how, if they've been improving over time, how dehydration plays a role, and kind of talked with the practitioners about ways that I thought we could possibly help them or lessen their symptoms and get their bodies functioning properly. I did research on supplements that they use there in the office, and these are a few examples. I did some thorough research to kind of understand them better, and I identified which patients we could use these with and how it would help some of the symptoms that they're having. And I also researched what foods these particular ingredients are in so we could supplement with the dietary approach. A lot of patients that come through the office have GI issues. So I developed some recipes, some gluten-free recipes to give to the patients. And a lot of times they kind of fear going on a gluten-free diet because they think that it won't taste very good. So I wanted to, kind of show them that there are some very tasty gluten-free items out there. I felt very lucky to be able to complete 160 hours at the Medical Nutrition Center. One of the practitioners has been in practice for 20 years. She did several years in a hospital setting, and she's had a practice for 8 to 10 years now. So she has seen a lot, and it was great to be able to kind of absorb the knowledge that they have learned over the past several years. And recently, they have both gotten, really educated on functional medicine. And I think this is so interesting because it's such a holistic approach, and it really focuses on not just one, system, but the individual as a whole, which I think is really important. I learned a lot of flexibility and adaptability. I'm a pretty structured person, and because it's such a fast-paced practice, there were a lot of things, that were out of our control. And we might not have gotten the work done that I was hoping we'd get done in a day. So at the end of the day, I had to realize you've got to be able to go with the flow, because in a lot of settings, you're not going to be able to control everything. So that was a big lesson for me. I really enjoyed getting to know the patients, and I built some strong relationships, and I really enjoyed getting to know them and seeing the interaction with the dietitians and the patients. It kind of hit me how much of an impact you really can make on these people. There's not just, discussions about nutrition, but a lot of them are counseling sessions too. And they rely on these dietitians for not just nutritional advice, but life advice as well. And it was great seeing those relationships being built. So in conclusion, I was kind of thrown into a situation that was a great learning experience, very valuable, And I got to learn a lot about, not just dietetics, but owning a private practice and what it takes to become a successful dietitian. And I feel fortunate because I get to actually go back to this practice for 7 weeks during my internship rotation. So I look forward to it. Thank you.